O positive, the global standard. O positive dominates as Earth's most common blood type, carried by 40% of humanity. Its medical superpower? It works for any H positive patient A, B, AB, or O. Emergency rooms depend on it, and blood banks stockpile it heavily because it saves the most lives when seconds count. Evolution favored type O for a reason. The missing A and B antigens block malaria parasites from clustering red blood cells, reducing severe infections. Ancient hunter-gatherers likely thrived with type O as their immune systems and digestive traits matched high-protein diets and wild pathogens. But there's a flip side. The exposed H antigen makes O types vulnerable to cholera and norovirus. Plus, lower clotting factors mean protection from dangerous clots, but increased bleeding risk during injuries. A positive, the farming evolution. 30% of people carry A positive, making it the second most prevalent type. These individuals can receive from A or O positive donors, giving hospitals flexible options. But A positive tells a deeper story about human civilization. As humans abandoned hunting for agriculture, type A surged in frequency. Why? The A antigen fights bacterial infections that spread rapidly in crowded farming settlements with poor sanitation. Evolution selected for it as populations densified. The trade-off? Higher risks of blood clotting disorders and cardiovascular problems. Nature's balance strength against infection, weakness in circulation. B positive, the Asian legacy. 10% of people have B positive, concentrated heavily in Asia and the Middle East. This geographic clustering reveals ancient migration routes and adaptation patterns. B positive recipients can take blood from B positive, B negative, O positive, or O negative moderate flexibility. Research links type B to altered infection responses and differences in metabolizing carbohydrates and fats. It's proof that blood types shape more than transfusions, they influence how our bodies process energy and fight disease. AB positive, the universal receiver. Less than 5% carry AB positive, yet it grants an incredible advantage. These people can receive any blood type. They're universal recipients, perfect for emergencies when supplies are limited. AB is evolution's newest creation, emerging only a few thousand years ago when A and B populations intermixed. Geneticists treasure it for studying human diversity. However, AB types face elevated clotting and vascular risks. Its evolutionary irony, maximum transfusion safety, heightened health vulnerabilities. O negative, the emergency lifeline. Only 7% possess O negative, but it's medicine's most critical blood. With 0 A, B, or Reach D antigens, it's the universal donor compatible with everyone. Trauma centers reach for O negative first when there's no time for testing. It's the difference between life and death in disasters. But rarity creates challenges. Like all O types, these individuals suffer worse cholera and norovirus infections. O negative mothers need careful pregnancy monitoring because if their baby is H positive, maternal antibodies can attack the child's blood cells. Despite vulnerabilities, O negative carriers are silent heroes of every healthcare system. A negative, the immune specialist. Just 2% have A negative, limiting them to A negative or O negative donors only. Every donation is precious because so few exist. The A antigen historically provided immune advantages in farming societies battling bacterial diseases. But the missing RHD factor complicates pregnancy. A negative mothers carrying Rh-positive babies risk dangerous antibody reactions. Modern medicine manages this, but historically it affected survival and reproduction significantly. B negative, the geographic rarity. Only 1% carry B negative, making it exceptionally scarce. These individuals accept blood solely from B negative or O negative donors, extremely limited options. Type B spread unevenly through history, common in Asia but rare in Europe and the Americas. Studies suggest B carriers show different immune reactions to certain pathogens, reflecting subtle evolutionary compromises. B negative represents one of the most selectively distributed blood profiles in human history. AB negative, the ultimate rarity. AB negative exists in less than 0.5% of people, the rarest blood type on Earth. While their red cells are extremely limited, their plasma is invaluable as a universal plasma donor for any patient. This blood type emerged from A and B population mixing just thousands of years ago. Adding the missing Rh-D factor makes it a genetic outlier. AB negative carriers represent the extreme edge of human biological variation, the rarest possible combination of all major blood antigens. Blood types aren't just medical labels, they're evolutionary fingerprints. They reveal how humans adapted to malaria, farming diseases, different diets, and population movements over thousands of years. From O positive's common versatility to AB negative's extreme rarity, each type balances unique advantages against specific vulnerabilities. Understanding these patterns helps us appreciate the complex biological diversity that makes humanity resilient across every environment on Earth.